title published in the Word for Worship called today's sermon, a sermon about health insurance. I need to tell you right off the top, I'm not going to try to wade into that crazy healthcare debate that's still going on in our culture, although there are pieces of that really do have implications for what we're talking about today. I wasn't able to get really up-to-date statistics, but 4 years ago, do you know what the leading cause of bankruptcy? 50% of the bankruptcies in this country were caused by medical bills. Medical bills. I don't know, perhaps it's been skewed a bit now with all of this foreclosure stuff and so on, but even with the foreclosure stuff, a lot of the foreclosures prior to this last mortgage mess were driven by medical bills too, where people couldn't pay for everything and something had to go. And it was not so long ago that 1 out of 6 still lived without any kind of health care coverage. So there is something going on there that we need to be paying some attention to. There is something going on there that we need to respond to. I'm just not going to do it in this sermon, but maybe we can find some ways to work on that, because Christian commitment to well-being, to human well-being, is really fundamental. It puts us on the side of people who are struggling to figure out some way to make sure that people are able to be well. That is a given in our faith. The how, we're going to argue about the how, and we're going to try this, and we're going to try that, and there'll be all sorts of carrying on about how to pull it off. But as far as the Christian community is concerned, that is a given. And these texts will kind of force us into a kind of a piece of that whole discussion. Try to help us understand some of the things that perhaps we can do, some things that are in the realm of our ability to control. We can't do everything that it takes to make individuals healthy. We can't do everything that it takes to make a community healthy. But there are some things we can do, some things that do make a difference. A difference for each other, a difference for ourselves, a difference for the community in which we live, a community in which, if we understand these texts rightly, a community in which resides our potential for wholeness. The wholeness that we are seeking is a communal kind of wholeness. These texts are fiercely communal. Well-being in the scriptural understanding of well-being is always relational. It's always in the function, in the context of a relationship. If we are well, it is because we are well together. And if one of us is not well, then it affects all of us. And so the health insurance that we're talking about this morning is the health insurance that has to do with the way we can be well together. And some of this in the Bible is shaped by some realities that maybe aren't quite so true for us. Back in the biblical day, they didn't have all of the whiz-bangy kinds of things that we have medically. They didn't know how to do the kinds of surgeries that we do today. They didn't have the antibiotics and the blood pressure medicine and all the rest of it. They had a rather limited ability to do things to an individual's body that would make things better. And so they had to resort to other things other than surgeries and medicines and all that sort of things. They didn't have those things. All they had was each other and God. And so in that context, and you see it in the biblical communities and in a lot of poor communities, even in our own time, in communities where you don't have access to all those other kinds of things, prayer becomes powerful medicine. Prayer becomes powerful medicine, and in particular, communal kinds of prayer. In that reading from James chapter 5, James says to the church, call the elders, and it's plural, call the elders of the church. Have the elders of the church pray over the sick people. Anoint them with oil in the name of the Lord. Not just the pastor, although the pastor should be one of those people. Not just the pastor, but a group of spiritual leaders out of the congregation go together to pray with the person who is sick. Who would those people be in our congregation? Who administers the healing medicine in our congregation? Who are the people who lead our congregation's health insurance plan, if you want to call it that? Suppose we needed to go this afternoon and pray for a member of our congregation who was sick. I intentionally said, who would volunteer to go? Understanding that if you go, you would also need to pray, as in with words, out loud, because it is the communal prayer that we would be offering together. Who would be the people in the congregation willing to be a part of that community of prayer? Because James said it's pretty powerful stuff. The prayer of faith, James said, will, and his choice of language here sounds odd to us, the prayer of faith will save the sick, as though somehow the sick person is lost in some way and needs somehow to be retrieved, pulled back into the circle, pulled back into the community. The prayer of faith will save the sick, and the Lord will raise them up. That's actually Easter language, the language that we use about Jesus when Jesus was brought back to life. The prayer of faith is somehow redemptive. The prayer of faith is somehow resurrecting. Anyone who has committed sin will be forgiven. So therefore, James says to each of us and to the congregation together, confess your sins to one another and pray for one another so that you may be healed. All of that happens together in community. It can't get much more communal than that. It can't get much more relational than that. You and me, one another, and the Lord. Wellness depends on all of that being right. The kind of wellness you can't get from the doctor's office, the kind of wellness you can't get from the drugstore, the kind of wellness you can't get from the hospital. It's a wellness that works even if by the end of the day the disease runs its course, because somehow or other this is redemptive and resurrecting. In the end, the death from which we ultimately must be saved is the death of alienation. The death of alienation from God, the death of alienation from each other. And there is no doubt about it, being saved is communal. Either we are saved together, or perhaps none of us is saved. At least that's how James understood it. But Jesus is pushing us in that same direction in that collection of teachings that we heard out of Mark chapter 9, today's gospel. Jesus says to the community, pay attention to the way your lives impact each other's lives. If you put a stumbling block before one of the little ones who believe in me, you're better off if you had just gone ahead and drowned yourself first. That was verse 42. And the language there is plural. You all be careful about this sort of thing. You all be careful that you take good care of those little ones. That relationship is communal. That relationship is a responsibility that we all share together for the little ones. The little ones who are children, but also the little ones who are weak, or the little ones who are unable to protect themselves, or the little ones who still haven't learned how to live together and how to take care of themselves and how to do all the things that adults have to do. The little ones who need the community to help them get along. You all look out for all of them, Jesus says in verse 42. But then, to make sure we get the point, something happened in verse 43 of today's gospel reading. In biblical Greek, you can use a plural you all, and you can also use a singular you as an individual, you as an individual. And that's what happens in verse 43. You becomes singular now. You, and you, and you, and you, and you. You cut your hand off before you make somebody stumble. You cut your foot off before you make somebody stumble. You poke your eye out before you make somebody stumble. Kind of sounds like shock jock talk. Maybe Jesus has been taking lessons from Rush Limbaugh or something like that. Maybe so. I don't know. Hyperbole, exaggeration, maybe. But somehow or other, if well-being is going to be communal and if it's going to be relational, if we are going to enter the reign of God together, or none of us is going to get there at all, if that's the way it is, maybe Jesus does have to lay it on kind of thick. Maybe Jesus has to lay it on kind of thick because looking out for each other is not really so much a part of the way we think. Look out for me, yes. Look out for my wife, look out for my children, look out for my own little circle, yes. But you, well, if I have some time left over or some energy left over or some money left over, then we'll see if we can help you out. That's a part of our culture. It's part of the way we seem to have become. And it isn't just us. In biblical time, we have this idea that biblical people somehow were saintly in ways that we weren't. If you go back to Matthew or to Mark's Gospel, chapter 7, just a couple of chapters back from where we were today, you discover that there were some really selfish individuals in that culture too. Some of the wealthy leaders in the community, some of the Pharisees and scribes, had figured out that they didn't really want to have to keep the commandment, honor your father and your mother, in the way that it needed to be kept in their culture. In their culture, there wasn't any pension plan, there wasn't any social security. Your pension plan when you got old were your children. And one of the reasons you had children was so that somebody would look after you couldn't take care of yourself. And so when it was time for mom and dad to not be able to work anymore, not be able to take care of themselves, they would turn to the children who would then provide a home and provide food and shelter and all of that sort of thing. And that was the way, literally, you honored your father and your mother, except that these people didn't want to do that. They didn't want to have to share their wealth with their old parents. And so they created kind of an interesting gods. You can read about it in chapter 7. They created this little trust fund that belonged to the temple, this little trust fund that belonged to the church. They put all their wealth in this trust fund, and then they said to mom and dad, I'm sorry, I don't have any money. It's all in the trust fund. I can't take care of you. And so that kind of individualism let them cut themselves off from the responsibility to their parents. That kind of thing is as old as the human race, I suppose. And so maybe Jesus did have to be shock jockey in order to get through to us. Because the only health insurance there really is when we get down to the bottom is when people look out for each other. When before God's throne of grace, we lift each other up and we pray for each other and we hold each other up. We can mandate all kinds of programs, and we have and we will continue to. We can make all sorts of laws, and we have and we will continue to. We can fund all kinds of coverages, and we can and we will continue to. And let's face it, you're not going to give up your Social Security check. I'm not going to give mine up when it's time. You're not going to give up your Medicare coverage, and when it's time, I'm not going to give mine up either. Those things are already part of the way we do things, and it doesn't matter who you vote for. I guarantee you those programs will not go away, because you won't let them, and I won't let them go away. Neither will my children let them go away. We need them. That's just how it is all put together. That's one of the ways we take care of each other. But still, the bottom line, underneath all of that, there is only still one thing that finally works. Before God's throne of grace, we look out for each other and we hold each other up. And that's where we find the healing balm. That's where we find the help. That's where we find what we need for ourselves and our families and our communities